you're back.
I am.
Wedding.
It was so good. Thank you so much.
Can I see pictures?
You can.
Yes.
Hold on. Okay. Here we go. Here's us on the beach.
Oh, you guys are so Are those pictures from your honeymoon?
They are. So
Oh
here's
my
us on the
God.
beach, and then here's one of us snorkeling.
Wow, you look good in your bikini. Oh, I'm so
Thank
glad
you.
you're back.
Can I see your ring? Yes, of course. Isn't it pretty? He did
Such a good
I know
job.
he did such a good job. And then here's us at the volcanoes. Oh my God.
There's
Cute
suit.
Nice seeing you.
Okay. Yeah, I gotta go.
All right.
Oh, I don't want to go back.
Me either, but you know.
When I hear them talk about their social life, I think in a normal, everyday hospital setting, it would be okay, but you're in such distress and so upset that it kind of makes you think that their mind is elsewhere. Maybe it's a little bit of jealousy also on top of it.
So I think if my baby was thriving at that time, it would be fine because, you know, you develop a relationship with the nurses. I might even chime in and talk with them too. But if I'm at that place where I'm with my baby and I'm scared for her, which I was with both of my babies, you know, it's like a roller coaster, as we all know. And they were talking about something so light, it might make me feel a little put off.
I would probably sort of listen in. It's a nice distraction, in my opinion. I want to know that they're paying attention to the children and my child, but you also need a little bit of downtime and distraction because the job can be overwhelming.
So tired. My third.
Who's getting my kids?
Oh, let's see. Oh, it looks like I have your assignment.
Okay, well, sorry for you because this day was awful.
It was bad.
It was so bad. This pairing is ridiculous. I bagged that one twice. This one didn't stop screaming all day long.
Wait, that was not supposed to be an assignment.
Oh.
The other day they broke them up.
Yeah, we told them that at Team
can't go
Rest.
on the reading.
We need to go talk to Charge.
Okay.
We need to tell
Let's
Let's
go talk to
somebody
the
has
charge.
have
So if somebody's telling me they're having a bad day, that means for me as a parent that they're not paying full attention. And for us, those crucial moments are to take care of your child. And if somebody is not up to it, you would just call it a day and go home.
So funny enough, we actually did have a shift where at the end of it, our nurse was ready to be finished with that shift. Been working with us for 2 days, and they were 2 very hard days. And I get it. The only thing there, though, is the parents don't go home necessarily.
Well, obviously, it doesn't leave a settling feeling. You want the nurse to, one, be passionate about what she's doing and care about your child, even though you know that your child is not the only child that she's caring for. And if they're thinking about leaving, then they're not really focusing on what their job is to be there caring for your child. In a lot of cases, they're critical or post-op, and they need a lot of attention.
Oh, hey, do you mind if I go to lunch real quick?
Yeah, go ahead.
Okay, I've got one down there. He's on a nasal cannula, and this one he should be fine.
Okay, take your time.
Thanks.
Hi, I'm Melissa with Child Life. How are you today?
Hi, I'm all right. I just can't seem to find my baby's nurse, and I wanted to talk with someone and see how he's doing today.
Oh, I'm sorry. Let me see if I can find someone.
Thank you so much.
When I come in, I expect to hear from the nurse pretty much everything that happened while I was gone. I expect her to know everything about his eating, his medication, his using the restroom, everything. That did happen to me, that you would come in and they were keeping an eye on him, but they didn't really know anything that had happened while you were gone. And it's pretty upsetting because it's stressful enough to be in that situation that you expect everybody to know everything. I know it's hard for everybody to know everything about every patient, especially when there's 8 patients in the room and they're just helping to cover, but you do kind of expect them to know.
Our main nurse that's been watching our baby is out to lunch, and another nurse is covering. I absolutely would expect them to come over. I mean, not right away, because I understand my baby's not the only one, but if possible within 5 minutes or so, or at least if she's not like attending to a baby actively, like at least acknowledge me walking in and give me a little head nod or a minute signal, and hopefully come over within 5 minutes if possible, and give me an update.
When I first arrive to see my child, I usually expect the nurse to notice that I'm there and to come in within the first 15 to 20 minutes. If they don't, I usually go looking for them and try to get an update. I won't just sit around and wait.
Nikki, this is Kara.
Yeah, I was just calling to see how little Ozzy was doing today.
He's doing fine.
Okay. Is that it?
Yeah, he's good.
Great. Okay. Thank you very much.
You're so welcome. Bye-bye.
All right, bye-bye.
That's it? So
Yeah.
how's he doing?
Fine.
What do you mean by fine? What's his oxygen at?
I don't know. She didn't say.
Is he still on TPN?
I have no idea. He's fine. She seemed like she didn't really want to talk right now.
I'm so frustrated. You need to call her back.
Okay, I'm sorry.
Nikki, this is Kara.
Hey, yeah, I was just calling to see how little Ozzy was doing today.
He's doing good. So we had a good night last night, pretty quiet. And rounds this morning was decided to take him off TPN. So he went up onto full feeds. His oxygen is down to 21%. He's sleeping right now. Do you have any specific questions?
No, I don't have any questions right now. We'll be in a little bit later. So if I think of any, I'll ask then.
Awesome. Call back anytime.
Yeah, thank you.
Bye-bye.
So how's he doing?
He's good. He's up to full feeds, believe it or not.
So
Totally off of TPN.
who was that? Who's his
Kara.
nurse? Oh, I love
yeah,
Kara.
I know.
I'm so relieved that she has him.
Yeah, I love when Kara has him too. Yeah, so excited to see him.
Me too.
Well, I had to call in a lot with our youngest baby overnight, because I would go home usually at night, and I would expect a lot of information, even if I just called you 30 minutes ago. And I know that could probably be annoying, but the nurses just need to realize that this is our life and our heart. I'll try not to tear up. It's very difficult to leave your baby.
Anytime that we called from home, our expectation was a full update.
Everything. You want to know the status of your child. Are they happy? Are they sad? Are they sleeping? Have they been given their medications? How the feedings are going was always a big thing for me. If they tolerated the feeding, just kind of a recap of what's happening since you've left. And obviously they might not know exactly when you left, but I think that they should start with when their shift started up until the point that you're talking to them.